And we're glad that you're here to join us today for the CMAA Study Set 3, Customer Service. Welcome back, and let's begin. What is the first step when transferring a telephone call? First step is to inform the caller of the intended transfer. Make sure that you always get permission before putting someone on hold or moving their call. How should a CMAA demonstrate empathy to a difficult patient? By repeating and documenting the patient's key concerns. This is a part of the active listening process, and it helps make the patient feel heard and validated. What are the 4 fundamental principles of customer service? Remember the 4: personalization, competence, convenience, and proactivity. Memorize these 4 specifically. Other good traits like fluency are not part of this core list. What is the ability to understand a patient's feelings and perspective? Empathy. Empathy is putting yourself in others' shoes. Which of the following is a synchronous two-way communication channel? Video call. Synchronous means it happens in real time with immediate feedback. Which of the following are socio-cultural barriers? The answer would be religion, gender, and language. High deductible insurance is a financial barrier, but not a socio-cultural one. Socio-culture means to be of social or cultural factors that shapes one's behavior. What is a key rule of professional etiquette for emails? Anything along the lines of refraining from the dealing of multiple issues in one email. One topic per email ensures clarity and better tracking in the medical record. You may also be presented with a match the Bloom's taxonomy levels to the definitions. Be sure to match as follows: remembering to recalling facts, understanding to processing information for health outcomes, applying to acting upon instructions, and evaluating to assessing if goals are being met. What skills are essential for effective customer service? Select all that apply. Empathy, patience, adaptability, and concise speech should all be selected if present. Be sure that you can tell the difference between behavioral skills, such as patience, and technical tasks, such as multitasking. What info is required when documenting a telephone call? Answers such as date, time, caller name and phone number, reason for call, and when a return call is expected are all appropriate for this answer. Note that messages are legal documents, so they must be complete so the provider can triage the call. When should a problem be escalated to a supervisor? Answers along unresolved patient dissatisfaction, complex insurance billing disputes, and clinical concerns are correct answers. Escalations is for issues of authority. Communication barriers like low literacy are managed but not escalated. What is an example of a cultural belief in healthcare? Belief that health information should be shared with family would be correct. Look for beliefs or values when the exam asks for cultural examples. What is the ability to convey a message in the fewest words possible? The correct answer, conciseness. Always pair conciseness with clarity. Professional conduct that ensures physical safety and respect is defined as what? The answer along the line of professionalism would be correct. This specifically refers to protecting patient dignity. Knocking before entering and providing gowns are examples of what? Respecting modesty. Modesty is directly linked to protecting a patient's physical dignity. Which are correct telephone etiquette actions? If possible, select all that apply. Speaking clearly, remaining pleasant, asking to hold, and answering within 3 rings all considered telephone etiquette actions. Be sure to never use speakerphones in public areas, as this is a HIPAA violation which can result in serious consequences. Well, that's all, and that will conclude our set 3 of the CMAA study, Vox. Thank you for joining us, and until next time, study on.